Meanwhile, the daily reports are being received on how health services across the Eastern Cape are starting to buckle under the pressure of the increase of coronavirus patients. Fear, anxiety, a lack of leadership and union pressure are seen to attribute to the state of affairs. The Eastern Cape MEC for Health Sindiswa Gomba is under fire to deliver solutions before it is too late. Our SABC News reporter Lwando Nomoyi sat down with the MEC and asked her the hard questions.
When I came into this department, I was shocked when I found the level of acting positions. Acting positions in their nature are not giving you confident management to deal with issues. Unions, workers have rights to raise those issues. But what I find, for me, not palatable, is the whole issue of unions wanting to raise old issues when we have a disaster, and not wanting for us to deal with a disaster and give us space to deal with those issues. Because first is what PPE is. Now we've gone over PPEs as you hear them. It's no more an issue. Now it's about the whole issue of decontamination or what they say is fumigation. This is an issue that we are debating because the way it is happening, it suggests that we will not have a hospital nor a clinic opened. So it is in the hands of the national ministry to come up with a protocol to be followed as to what must happen, because there's suddenly inconsistency in dealing with those issues. In some issues, venues or facilities will be closed totally. And we are now wanting to decant people, take them to other hospitals, which to a certain extent is not fair on the patients. But at the same time, for it to balance with the workers' needs and their fears, there has to be something that is now uniform for the whole of South Africa as to how do we deal with these issues.
So MEC, another question I'd like to ask is, ground floor level management, administratively within hospital management, there's been this standoff between healthcare workers and management, which also leads to the collapse of this. We've heard reports of a specific hospital here in Port Elizabeth, which is Doranginza, whereby the labor ward, is inundated, and the workers that are currently there, the healthcare workers that are currently there, they cannot actually withstand the pressure within that maternity ward. So how are we going to navigate around this particular situation?
I got a bit frustrated getting to this department, finding that even if you were to go to understand what the voters are saying in terms of their wishes for the Department of Health, you would not even be able to implement them and deliver. Remember, health is a service delivery imperative. And the excuse that you'll have, which is not the excuse anyway, is the truth, is that Department of Health is bankrupt. Bankrupt in the sense that it is challenged in courts left and right, and it has to pay those monies that are challenged on the basis of the issues of litigations. So if you've got such a department that is challenged in that way, the Premier put up a committee. As he put up a committee, what I did in the department was to find people, rapid response, that will take those that are highly litigated, Doranginza being one of them, to actually go into maternity, assist those midwives, look at what is short, because sometimes it's not even that they are careless. If you take an example of a hospital that has got one theater, if you've got two emergencies, what do? Then it suggests that the other one is going to have a fresh stillborn on the basis of such. Because you had one theater, and the theater was already in use and occupied. So the issue is under microscopic observation, and I do believe also we had challenges of unscrupulous legal minds who were taking chances with the department. We have subsequently dropped a bit in terms of that. We still, however, have a lot.
We've heard the supplementary budget by Minister of Finance Tito Mboweni yesterday, and he allocated just over 20 billion rand, for health within the country. And what does that speak unto, for this particular province?
Well, it's a good injection, which is motivated, of course, by a disaster. It needed government to think on its feet. It needed government to reprioritize its own priorities. And obviously, you can't continue as if there's nothing. Now we're waiting to see what is going to be the share of the Eastern Cape. And obviously, we'll also be having our own adjustment budget in July. Then our own treasury, of course, guided by the Premier, will be what we will see in July.